I've checked my patient's medical records and there's an order from the primary healthcare provider to insert a catheter. Hi, my name is Lexi. I'm going to be your student nurse today. Can I have you tell me your first and last name and date of birth? And I'm checking the ID band. Perfect. I'm going to be inserting a catheter today. At this point, I'm going to provide privacy, perform hand hygiene, and raise the bed up to a working height. At this time, I would also arrange for extra nursing personnel to help with this procedure if necessary. I'm going to lower the side of the bed. And place a waterproof pad underneath my patient. I'm going to assist my patient into a supine position with his thighs slightly abducted. And now I'm going to cover him up, exposing only the genitalia. Now I'm going to put on clean gloves, and I'm going to wash the perineal area with warm water and soap. Take off my gloves, perform hand hygiene, and at this point I would set up a light source to illuminate the perineal area. Next, I'm going to set up my sterile field. I'm going to place this bag on the bed to use for garbage. I will first pick up my sterile drape, touching only the 1-inch border, keeping it sterile. I will place it shiny side down. Next, I'm going to put my sterile gloves on. Next, I'm going to pick up my fenestrated drape, place it over the perineal area. I'm going to set up my tray. I'll pour antiseptic solution over my cotton swabs. Apply my lubricant to the tray. I will set my specimen cup with the lid loosely on it to the side. Next, I will hook up my sterile saline to my catheter. And move my catheter. And then put the contents back into my tray and move it to the bed. Now, at this time, if my patient was uncircumcised, I would retract the foreskin. Since he's not, I'm going to just lift up the penis and begin to clean it with the antiseptic solution and go in a circular motion around the glands 3 times. Now that I'm done with that, I'll place this to the side. Next, I'll grab my catheter 2 to 3 centimeters from the tip and insert it into the urethra 7 to 9 inches or until I see urine. And now that I see urine, I'll advance it another 1 to 2 inches and begin to inflate my balloon. I will assess my patient for pain. If he states he is in any pain, I will immediately deflate the balloon, insert another 1 to 2 inches, and slowly reinflate it. Since he is not having any pain at this moment, I will continue to inflate the balloon. At this point, I would retract the foreskin if he had any. I'm going to take off my gloves, perform hand hygiene, put on a pair of clean gloves, and I'm going to attach the tubing to his upper thigh, allowing slack for movement. I will attach the bag to the frame of the bed, and I'm going to grab a urine sample of 20 milliliters. I would date and label that. Next, I'm going to clean this perineal area to get any extra antiseptic solution off with soap and water. And I will thoroughly dry it. I will take off my gloves and I will clean up my station. At this point in a clinical setting, I would rip this fenestrated drape, but for the purpose of this video, I'm going to leave it. Now that my area is cleaned up, I'm going to perform hand hygiene and assist my patient back into a comfortable position. I'm going to raise the side rail up and lower the bed back down to the lowest position. Now I will palpate the bladder for any distension. I will look at the catheter and the tubing for any leakage and note the color and appearance of the urine. Now that I am done with that, I will document the type and size of the foley used, the amount of sterile saline used to inflate the balloon, the reason for catheterization, how my patient tolerated the procedure. I will chart the characteristics and amount of urine, and I will initiate the I's in O order. Also, if I know that the catheter is in the bladder and I have not seen any urine within the first hour, I will immediately notify the primary healthcare provider for an absence of urine. Thank you.